Histex-Dm is a combination medication used to treat symptoms caused by the common cold, flu, allergies, hay fever, or other breathing illnesses such as sinusitis and bronchitis. It contains dextromethorphan, which is a cough suppressant that reduces the urge to cough, and decongestants that help relieve stuffy nose symptoms. It also contains antihistamines that relieve watery eyes, itchy eyes/nose/throat, runny nose, and sneezing. It is important to note that cough and cold products have not been shown to be safe or effective in children younger than 6 years old. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products, such as long-acting tablets/capsules, are not recommended for use in children younger than 12 years. Always ask your doctor or pharmacist for more details about using the product safely. It's also important to remember that these products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions. Do not use this product to make a child sleepy. Also, do not give other cough and cold medication that might contain the same or similar ingredients without asking the doctor or pharmacist. Always consult the doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drops/spray. When taking Histex-Dm, make sure to carefully follow the directions on the product package or as directed by your doctor. You can take this medication with or without food, and it's best to take it with a full glass of water. If you're using the liquid form, be sure to measure the prescribed dose with a medication measuring device, and do not use a household spoon. If you're taking the extended-release capsules, swallow them whole and do not crush or chew them. The dosage of this medication is based on your age, medical condition, and response to therapy. If you're taking it for allergy or hay fever symptoms, take it regularly to get the most benefit from it. Remember, do not increase your dose, take it more often, or use it for a longer time than directed. If you have any questions or concerns, be sure to consult your pharmacist or doctor. And if your condition lasts or gets worse, make sure to inform your doctor. Some common side effects of Histex-Dm include drowsiness, dizziness, headache, blurred vision, upset stomach, nausea, constipation, or dry mouth/nose/throat. To relieve dry mouth, you can suck on sugarless, hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. This medication can dry up and thicken mucus in your lungs, so be sure to drink plenty of fluids unless otherwise directed by your doctor. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. If you experience any serious side effects such as mental/mood changes, ringing in the ears, trouble urinating, weakness, easy bruising/bleeding, fast/slow/irregular heartbeat, or seizure, be sure to tell your doctor right away. A very serious allergic reaction to this drug is rare, but if you notice any symptoms of a serious allergic reaction like rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. If you notice any other effects not listed here, it's important to contact your doctor or pharmacist for further guidance. Before taking Histex-Dm, it is important to inform your doctor or pharmacist of any allergies you may have, as this product may contain inactive ingredients that can cause allergic reactions. It is also important to disclose your medical history, especially if you have breathing problems, diabetes, glaucoma, heart problems, high blood pressure, kidney problems, liver disease, seizures, stomach/intestinal problems, overactive thyroid, or urination problems. Histex-Dm may cause dizziness, drowsiness, or blurred vision. It is advised to avoid alcohol or marijuana while taking this medication, as they can increase these effects. It is recommended not to drive, use machinery, or do anything that requires alertness or clear vision until you can do so safely. If you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, consult your doctor or pharmacist before using this medicine, as it may contain aspartame. Liquid preparations of this product may contain sugar and/or alcohol, so caution is advised if you have diabetes, alcohol dependence, or liver disease. It is important to inform your doctor or dentist of all the products you use before having surgery, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, especially dizziness, drowsiness, mental/mood changes, constipation, fast heartbeat, trouble urinating, and blood pressure changes. Dizziness, drowsiness, and confusion can increase the risk of falling. Children may also be more sensitive to the side effects of antihistamines, and in young children, this medication may cause agitation/excitement instead of drowsiness. During pregnancy, Histex-Dm should only be used when clearly needed, and the risks and benefits should be discussed with your doctor. It is also important to consult your doctor before breastfeeding while taking this medication. It's important to be aware of potential drug interactions with Histex-Dm. Always keep a list of all the medications and herbal products you are using and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Avoid taking certain MAO inhibitors while using Histex-Dm, as it may cause a serious and possibly fatal drug interaction. It's important to consult with your doctor about when to start or stop taking this medication, especially if you are taking MAO inhibitors. Other products that may interact with Histex-Dm include antihistamines applied to the skin, opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, and other antihistamines. Check the labels on all your medicines, as they may contain ingredients that cause drowsiness. Histex-Dm may also interfere with certain medical or lab tests, potentially causing false test results. Make sure that all medical personnel and doctors are aware that you are using this medication. If someone has taken too much Histex-Dm and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 or a poison control center right away. Symptoms of overdose may include agitation, confusion, flushing, hallucinations, large pupils, muscle twitching, seizures. In children, excitement may occur first, and may be followed by loss of coordination, drowsiness, loss of consciousness, seizures. Remember to keep Histex-Dm out of reach of children and pets. If your doctor has prescribed Histex-Dm, do not share it with others. It is important to keep all medical and lab appointments while taking this medication. If you forget to take a dose of Histex-Dm on your regular schedule, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take the next dose at your regular time. Don't take double the dose to make up for the missed one. Make sure to store Histex-Dm at room temperature, away from light and moisture. Do not keep it in the bathroom, and do not freeze the liquid form. Keep all medications out of reach of children and pets. When you no longer need Histex-Dm or it has expired, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.